As we approach 1 week since President Trump signed the big beautiful bill into law, state health leaders are sounding the alarm, saying the bill's impact over the next 5 to 10 years could lead to closures and reduced services for rural hospitals due to cuts to Medicaid. My UP's Skylar Perkins has the latest from legislators and hospital experts.
On Independence Day, President Donald Trump signed the One Big Beautiful Bill Act into law. And since then, it's drawn ire from statewide hospital leaders.
Republicans in Congress voted to take away people's health care and use the money to pay for new tax breaks for billionaires and wealthy corporations.
Leaders of the Michigan Hospital Association called out the issue at a news conference, with others calling attention to research showing hundreds of rural hospitals across the country were already at risk of closing. And the numbers suggest those risks of closure could increase, with Medicaid payments making up a larger total percentage of rural facilities' income.
These cuts will not just jeopardize access to care for Medicaid patients. They will jeopardize access to care for all of us throughout the state of Michigan.
It's a possibility that hits home in the UP, with the closure of Aunt Noggin's Aspirus emergency room just last year, leaving local residents an hour away from emergency care.
We got a lot of health problems. Everybody got a lot of health problems. And we need people around. We need a hospital. We need an emergency room.
Northern Michigan's representative in the House, Congressman Jack Bergman, has been a voice in the larger efforts to call out so-called waste, fraud, and abuse. In a statement Thursday, he told us, "I hear the concerns surrounding the law, and I take them seriously. But calling these reforms cuts is disingenuous, and it comes at the expense of the most vulnerable. And that the bill puts resources where they're needed most and gives states more flexibility to support care in rural communities." We also reached out to local hospital systems for their insight on the cuts, with Aspirus telling us currently they don't anticipate any disruption to their facilities or services, and UPHS saying they plan to continue the mission of pursuing a healthier region and using the time between now and when the proposed cuts are set to take effect in 2028 to plan for any potential cuts and collaborating with the community for a possible solution. As of now, there are 14 rural hospitals in the Upper Peninsula. Later tonight at 11, we'll take a look at which facilities researchers say are the most vulnerable. In Marquette, I'm Skylar Perkins for My UP News.